Boa noche. I'd like to thank the leaders and organizers for inviting me to this very important conference. It's an honor for me to be participating in ISEP's International Workshop on Demand Reduction because the work we are doing together is incredibly important. I wish I could be there in person, but President Obama requested I stay in Washington for a meeting. I also send my condolences regarding the recent tragedy involving your soccer team. My thoughts and prayers are with the family and victims of the people of Brazil at this difficult time. I have long admired Brazil in part because of our country's long history of working together to solve complex and challenging problems. We were allies in World War II, we worked together on the Haiti earthquake response, and we both are working to prevent drug use and reduce its consequences, including crime and poor health outcomes. As the United States Director of National Drug Control Policy, I work with President Obama to develop and implement the United States drug policies. Tonight, I will talk about how the United States has changed our approach to substance use prevention and treatment over the past several years to better address the needs of people with substance use disorder and what the effects of this are. Our approach to the drug problem has changed dramatically under President Obama's direction. Decades of scientific research have proven that substance use disorders are a health issue similar to heart disease and diabetes. They are chronic medical conditions that can be prevented and treatment. All of the President's efforts have been guided by science, research, data, and input from public health and safety officials nationwide. That's why, this past February, President Obama put forth a plan that balances our drug-related spending between public safety and public health. For the first time in our nation's history, our government wants to spend similar amounts on law enforcement and interdiction and prevention, treatment, and recovery services. We have moved to a more balanced approach to the drug problem. And the United States is not alone in countries embracing this approach. At the United Nations General Assembly Special Session on Drugs this past April, all member states agreed to the outcome document, which said that this balance between public health and public safety must be a core principle for every nation. Too often, resources for drug prevention, treatment, and recovery support have fallen short. All governments have an obligation to assess their commitments and consider if citizens affected by substance use disorder require more assistance. First and foremost, preventing substance use from beginning is the best strategy to reduce its consequences. Prevention is a fundamental element of our government's national drug control strategy. In fact, it's the first chapter. Prevention is also a major part of the historic report on addiction that our Surgeon General, the top doctor in the United States, released last month. This report includes a comprehensive listing of evidence-based prevention programs, and we hope it will serve as a valuable resource to other countries. My office is working with the United States Department of State to distribute this report to every U.S. embassy in the world. So please contact the U.S. Embassy in your country for information on how to receive a copy. This knowledge is based on the dedicated work of scientists, researchers, and practitioners from all around the globe over the past 3 decades. When it comes to prevention, we have done the research, we have the evidence, and we know what works. We know that there are predictors of substance use and misuse from birth through adulthood, and that a variety of prevention programs that address these predictors prevent people from beginning substance use, no matter how young or old they are. There are evidence-based prevention programs that target the whole community and high-risk populations. They can be based in schools, in a family setting, and on the internet, and they are proven to reduce substance use. We know that making it harder to access substances like alcohol can reduce the risk for misuse. And we know that to be successful, we need our communities to be involved. It can't just be the government's responsibility. This is why I am so pleased to see how many civil society actors from Brazil and elsewhere are here at ISEP. And the key role of Brazilian NGOs in this workshop is also worth noting. Effective substance use prevention requires that we bring together our leaders in local and state government, public health, and law enforcement, as well as other members of the community. All sectors of society have a role to play. Building strong relationships in the community helps us to develop strategies to successfully address community-level challenges. These partnerships are also uniquely poised to identify emerging threats. One important way our government promotes prevention is through the Drug-Free Communities program that my office administers. This is a grant program in the United States that supports nearly 700 local coalitions that are working to prevent drug use in their communities. Other countries across the globe have similar programs. Those of you working in the community have the power to reach people vulnerable to substance use, especially youth. You can reach parents, teachers, local leaders, public health officials, and law enforcement officers who can help extend your reach. One former Drug-Free Communities grantee in the state of New Hampshire is called Youth to Youth. It's a student empowerment program coordinated by the police department and is recognized as an evidence-based prevention program. The members meet weekly to develop creative ways to address substance use issues. They've been around for a while now, but in just 1 year, Youth to Youth students gave presentations to more than 2,000 of their peers and parents in the community about substance use issues. They created 10 public service announcements and 2 TV public service announcements that aired locally. And they convinced a gas station near the school zone to remove 15 signs advertising tobacco products. On top of this, they helped other coalitions. They've set up a network of youth groups in the surrounding area that follow their model. And they develop a youth empowerment toolkit that is being used all across the country. Our Drug-Free Communities coalitions are engaging their communities, and actions like these are resulting in positive outcomes. Our 2013 grantees saw past 30-day use of alcohol, tobacco, marijuana, and prescription pain medications drop among both middle and high school students. This is really encouraging news, and it shows that by being active in your communities, engaging people, and using evidence-based strategies, you can have a major effect. When prevention isn't possible, we need to make sure people can access the treatment they need to reach recovery. And we need to treat substance use disorders like the disease they are. Ensuring access to life-saving substance use disorder treatment is key to improving the health of our nation and to helping people with this disease live healthier, more productive lives. This is not a new idea. In 1962, Attorney General Robert F. Kennedy, the brother of President Kennedy and then our nation's highest law enforcement officer, spoke at the White House Conference on Narcotic and Drug Abuse. During his speech, Attorney General Kennedy said, and I quote, "This field reaches across many disciplines, psychology, sociology, economics, and medicine, as well as criminology, and yet we have persisted in letting almost the entire burden fall on our law enforcement officers. But law enforcement is only one aspect. The root of the problem remains. To turn this crisis around, we have to focus on both the law enforcement and the public health aspects of substance use. We have to get at the root of the problem, and we can't treat only the symptoms like criminal behavior. We have to treat the whole person. While it remains a top priority to reduce the availability of drugs and to reduce drug trafficking networks, we know we can't arrest our way out of this crisis, and that we have too many people incarcerated instead of receiving the treatment that they need. Treatment works. There are millions of people in the United States and around the world who are living successfully in recovery, and I'm one of them. People who have been affected by and survive substance use disorders can play critical roles in helping others get treatment and find recovery. Over the past 28 years, I've dedicated my life to this work so more people can have the same chance at recovery that I did. In my role as the Director of National Drug Policy, I have traveled around the U.S. over the past 2 years. I visited places like Ohio, Connecticut, Tennessee, and Utah, and I've spoken with local leaders, people in recovery, and parents who have lost children to this epidemic. And everywhere I go, I see that we have more work to do in ensuring that there is enough trained treatment providers and facilities for substance use disorders in communities across the country. This is a problem across the United States and across the globe, one that we must work on together so more people can get the help that they need, achieve recovery, and live healthier lives. President Obama is very supportive of increasing funding for prevention and treatment, and if we are able to secure more funding, it will be because he's led the way. Having his support makes a world of difference. And I know that resources are hard to come by with so many competing priorities. Substance use sometimes are overlooked, and this has been the case in the U.S. as well. But it's time that every country, including the United States, dedicates more resources to demand reduction. Of course, funding is not the only issue. We also need to make sure we are adjusting our policies, programs, and training efforts to support demand reduction. In the United States, we are encouraging more physicians to learn how to identify signs of substance use disorders so people can get the help they need before the disease becomes chronic. And we are taking steps to make sure substance use disorders have parity with other health conditions, that they are given the same level of attention as cancer and diabetes and heart disease. Through President Obama's healthcare law, our Department of Health and Human Services estimates that we have expanded mental health and substance use disorder benefits and protections to more than 60 million people. So we are moving in the right direction. The reason we are able to build the body of evidence and research we have and to develop effective evidence-based strategies is because of our data collection efforts. It is critical to have reliable systems in place to track drug use trends, what the impacts are, and who is being affected. This also allows us to monitor the results of our prevention efforts to make sure they're effective and to change course if needed. By working together and with the support of international organizations, we can enhance your data collection systems to track drug use trends and better understand the needs of the populations that you serve. Knowing who is being affected will aid tremendously in developing programs to help all of our citizens. In conclusion, the Obama administration has changed how we approach substance use disorders to focus more on prevention and treatment than ever before. We are working to build more resilient communities and get the whole community involved in preventing drug use and helping people achieve recovery. Our success depends on engaging our neighbors, our youth, parents and teachers, our law enforcement officers and public health officials, and other members of our community. We all have a role to play to expand quality, evidence-based substance use prevention and treatment resources. As your countries consider your own drug control strategies, I urge you to prioritize preventing drug use before it starts. Investing in prevention can save countless untold lives. This is especially true with regard to our young people who have their whole lives ahead of them. We have the knowledge to prevent substance use, so let's put this knowledge to good work. Last October, President Obama said something that really resonated with me. He said, when it comes to substance abuse treatment and recovery, those things are possible if we work together and if we care enough about each other. As I have said at the beginning of my remarks, the United States and Brazil have a long history of working together to solve complex problems. But it does not matter if you live in the United States, in Brazil, elsewhere in Latin America, or in another region. If we all work together in our countries and across our regions, we will be successful. Thank you for being engaged in preventing drug use and improving lives in your communities.